Hello, dear colleagues. My name is Inna Sharypova. I am a medical doctor, dermatologist, head of the Clinical Institute of Anti-Aging Medicine and the Anti-Aging Medical Corporation. Today I will talk about application of RegenLab Autogel, which we get from ATS and BCT tubes. We use it for lifting and natural filling of wrinkles, fold and volume loss, restoring the density, elasticity and metabolism of the dermis. We have been using RegenLab with our patients for more than 13 years. And we have performed only in our clinic over 15,000 procedures, and our patients are very satisfied. They come back to us again and again because they know that they will get very natural, long-lasting anti-aging and rejuvenating results. Today, we'll show how to work with BCT tube, which we use to obtain platelet-rich plasma. How to properly activate PRP with the patient's own thrombin, which is obtained from ATS tube. We'll show techniques of using RegenLab kits for correction of various age-related and aesthetic changes of the skin of the face, neck, décolleté and hands. I'll demonstrate how to work in the periorbital area and show the optimal techniques for correction of dark circles under the eyes. We'll move on to work in the zygomatic area to restore volume and the temporal area. Then I'll show injections which are most often used for lifting of the upper third of the face. Then, as a part of the full face technique, we'll work on the nasolabial folds, chin, and the lower line of the face. We'll talk how to avoid weighing down the oval of the face and how to make it lighter. We'll work on the area near the ear and after perform injections at lifting points with minimally invasive boluses to get emergency lifting effect if necessary. Let's begin our demonstration. The patient's name is Ekaterina. Today we'll show the full face technique and you'll see all possible methods of RegenLab injections. We'll start with correction of the lower part of the face, then we'll correct the corners of the mouth and the chin and go on in the nasolabial fold. In the area around the eyes, we'll correct the dark circles. We'll form a zygomatic zone. This way we can give good lifting for the middle part of the face. Then we'll move to the forehead to work with zone that will help us to get lifting of the upper third of the face. After that, we'll proceed the correction in the neck area in order to improve the turgor, smoothing and skin tone there. For the full face procedure, we'll use the Regen ACR Plus kit, which includes all the tools we need. It includes 2 BCT tubes. They separate platelet-rich plasma after blood draw and centrifugation. An ATS tube where we will get patient's thrombin. We'll use it to activate platelet-rich plasma and produce autogel, a gel for aesthetic correction made from the patient's own PRP. Also, the kit includes all the necessary medical devices for blood collection, a full set of syringes for all the techniques that we will use today, and also set of needles for the procedure. There are 30G needles, 25 mm long, 13 mm needles, and a needle for nappage. Now let's open the set. The trails are sterile, so they can be used later for the procedure. Now we start blood draw. 20 minutes before the procedure, we recommend to the patient to drink 1-2 glasses of water. Blood sampling is carried out through a special adapter which provides minimally traumatic transfer of blood cells into a PRP tube. Immediately after the draw, it's necessary to gently turn over the tubes 3 or 5 times before placing the tubes to the centrifuge. The centrifugation must be performed with a rotor fixing the tubes at an angle of 45 degrees. The centrifugation is performed during 5 minutes with a gravitational force of 1500 G. On original RegenLab centrifuge, it corresponds to 3400 rounds per minute. The patient is carefully prepared for the procedure. It's necessary to wipe the face twice with an antiseptic solution. After centrifugation, we get pure standard PRP, free from cells that can cause pain and negative reactions, thanks to perfect RegenLab separating gel in the BCT tube. And we also have one ATS tube with the patient's thrombine to activate the platelet-rich plasma and make autogel. Before we start filling the syringe, it's important to turn over the tubes 5 times to homogenize platelets in PRP. We begin the procedure by collecting thrombin with thick, long needle. You need to slightly stir the clot in the tube to get the thrombin serum. We take no more than 0.1 milliliter. Carefully, in order not to push thrombin to the BCT tube, we take platelet-rich plasma, which is currently liquid. In the syringe we have a mixture 0.9 milliliter of platelet-rich plasma activated by 0.1 milliliter of thrombin. Now we have autogel and we begin to form the oval of the patient's face with it. We are looking for the area of the deepest wrinkle and look carefully at the location of the blood vessels in this zone. We see the superficial vein. We know that the facial artery passes in this area. So we insert the needle intradermally to place the gel on the movement back. Remember that the facial artery and the facial vein pass through this zone. Therefore, before injecting, we always carefully look at their location. We perform linear retrograde filling of the wrinkles. With a small amount of platelet-rich plasma, we can work in the areas that need delicate correction. With PRP autogel, it is safe to work even with hypercorrection because PRP doesn't contain hyaluronic acid. We repeat the process. In the mouth corners, we work with the tendon of musculus depressor angulioris to restore elasticity of the tendons and raise the corners. Shortening and compaction of tendons is one of the causes of marionette lines that go from the corners of the mouth to the chin. RegenLab PRP works better than other methods with the muscles which depress the corners of the mouth, because PRP restores the elasticity. Here we form the angle of the lower jawline with a linear and bolus technique. This manipulation is needed to elevate the oval of the face and to provide lifting of the lower part. We move to the correction of the nasolabial fold. It's carried out by the cross-link technique. Course of 3 procedures with PRP RegenLab once a year allows to fill the nasolabial folds and prevent their formation. And now we'll do correction in the periorbital area. This is an interesting complex area. To work most effectively with dark circles under the eyes, you need to learn how to fill the tear trough with a needle, not a cannula. This is important. And it's important not to touch the neurovascular bundle, which is located in this area. It was shown on the slides. We inject the needle slightly laterally from the central line of the pupil. The needle goes superficially in the lower part of the dermis. PRP is injected in an amount of 0.2–0.3 ml, and then we move it towards their nose by the fingers to avoid the hematoma. As the angular vein is located here, we stop the needle about 1 cm before it and inject 0.2 to 0.3 ml of PRP depending on the size of the dark circles under the eyes. And now we'll show how to work in zygomatic area. The formation of the cheekbone and filling of the lateral part of the orbit is performed at the same time. Now we demonstrate retrograde injection. We should take care about blood vessels. The injection can also be made by large intradermal papules, because here we want to avoid the superficial veins. Now we'll work carefully on the oval of the face and area near the ear, because this area is also extremely important in the formation of the contour of the face. Therefore, we'll go with the retrograde technique in this area, which will give us a good chin lift. Outer gel injections are made with a 30G needle, 25 mm long. This needle size is the best for shaping the oval of the face and in the area around the eyes. On the upper eyelid, we work with a 30G needle, 13 mm long. Now we'll work with area near ear and with the earlobe. These injections are important to form a young, beautiful earlobe. And now we see that piercing hole has become round and young. After we finish with the right side of the face, we show how our patient's face has changed during the procedure. We fill this zone to form a beautiful contour. In the temple area and with the upper eyelid, we work with a shorter needle and try to direct the needle away from the eye. We carefully look to avoid the surface vessels, which are usually clearly visible in this zone. Papules should not be subcutaneous. They must be intradermal to have long-lasting results. The injections of autologous gel into this area firms the upper eyelids and makes the look more open. Here we work with small intradermal papules, which become invisible within an hour after procedure. Filling the temporal zone, it's principal to lift the upper eyelid and eyebrow. Injections in the area of hair growth are also needed for lifting of the upper part of the face. In the area between the eyebrows, injections are made very carefully and very superficially under the control of an aspiration test. We carefully inject the entire platysma area with Regen PRP and solve two important tasks at once. We increase the turgor of the skin and improve its texture, as well as return the elasticity of the muscles, which is lost over the years. Because of this, platysma begins to pull the tissues of the oval down. And by restoring the elasticity of the platysma, we allow the oval to rise back and recover. This gives a general lifting of the face and neck. The nappage technique is very important in this procedure. It's necessary for the normalization of the structure and function of the upper layer of the dermis and the basal layer of the epidermis. We treat our hands with the technique of deep intradermal papules with an interval of 1 centimeter. We avoid the tendons. An important advantage of RegenLab is that PRP injections improve the condition of ligaments and tendons and improve hand mobility. The treatment is finished. After the procedure, we apply CMG Linda Kristel emulsion to the skin. This is a special emulsion for skin after laser exposure or injections. CMG has an anti-inflammatory, wound healing, and moisturizing effect. After the procedure, I do a massage to distribute PRP more evenly. RegenLab PRP provides the effect of powerful regeneration, and facial modeling. Our procedure is over. Thank you very much, Ekaterina. Katya, thank you very much for taking part in our film. I hope that the results, as usually, will bring you great satisfaction. Dear colleagues, I present you the book about the standards of work with platelet-rich plasma for skin, hair, and degenerative changes in soft tissues. In this book you can get all details and schemes of PRP use. Here you will find how to mix PRP to obtain the best effective density of the autogel for correction of various problems in different areas of the face, neck, décolleté and hands. Thank you very much for your attention. I hope that our seminar today was useful for you, and I hope to see you soon.